The IRS does an estimate of how much money they should be collecting and compares that to how much money they actually collect. This gives them a sense of how many people are not complying with the tax code or are tax evaders. We report on how much money is recovered from fraud arrests, but without any measurement of the fraud problem. It's hard to know how much of a difference we're making. Have you ever done an official estimate of fraud in the Medicare program? And has CMS ever done an official estimate for the panel? So we'll start with Ms. King.
Yeah, we have not. Part of the difficulty is that it's hard to measure what you don't know about. If, for example, I submit a claim for a service that was never provided, and that claim looks totally legitimate, it's going to be paid. But that is, in fact, you know, it's a fraudulent claim. So there are things like that that happen that are not captured in that. We have noted the lack of a reliable estimate of fraud in Medicare and urged CMS to work on it. And I believe that they are starting on a pilot to measure the extent of fraud in home health. It's a difficult undertaking, but they are working on it.
So when do you expect the pilot to be rolled out?
I think that they just talked about it in the most recent report that was released within the past few weeks, the Healthcare Fraud and Abuse Control. And I would imagine, you know, I can't speak for them because I don't know their exact plans, but I would imagine it would take some time.
Dr. Cosgrove?
Yeah.
Oh, I'm sorry. Do you want to finish, ma'am? I didn't want, okay. Dr. Cosgrove, you?
Thank you. I don't have anything to add to Ms. King's
Okay.
statement.
How about Mr. Vito?
I think fraud is only when it's determined at a court of law that's when fraud occurs. You know, you could have indications of fraud, but it's only when it's finalized and the case has been adjudicated. I think what we're trying to say is that CMS they have data and they need more data. And when they have that data, they need to analyze that data. And that would help them identify what's going on in their programs. For example, in the Part D area, if they got information on what the plans are reporting as incidents of potential fraud, then they can look behind that. They could use that data to compare it to fraud areas to see if that contract, that Part D program is actually doing a good job in detecting and preventing fraud, waste, and abuse. They can compare it to their others. So for me, I think you're asking about data and the use of data to make informed decisions and to target your work. And that's what we're advocating with CMS, that they use the data they have and maybe enhance some more data so that they would be able to target their resources in the best manner.
Thank you. Next question. Many of the monetary, criminal, and civil penalties for fraud were established in the 80s and 90s. Do you think these monetary penalty amounts should be updated? Ms. King?
I don't have the expertise to comment on that, sir.
Okay. Dr. Cosgrove?
We have not done any work in that area.
I am not a lawyer or a prosecutor. I can tell you, though, we have those people, and we would be certainly willing to answer your question or meet with you to talk about your question.
Well, that's fine, but yeah, I mean, if they were, if the penalties were established in the 80s and 90s, that was a heck of a long time ago. So I would think they would need the updating. But yes, I'd like to get with you, Mr. Vito, on that.
I think we could certainly meet with you and tell you.
Okay, next question. GAO has Medicare listed on their high-risk programs. Medicare has probably been on the high-risk list longer than some of my staffers have been alive. Has CMS done anything recently or in the foreseeable future that would move Medicare off the high-risk program list? Who would like to respond first?
I will, sir. We are in the process of updating our high-risk report for the next issuance. And Medicare is an inherently complex, it's an expensive program. It is, as noted, you know, taking up a larger share of the federal budget and of national spending each year. So It's an intrinsically complex program, but we are in the process of evaluating whether it should continue to be on the high-risk list. It has, however, been there since 1990, since the very beginning of our high-risk list.
Thank you. Thank you. Dr. Coswell.
Well, I just want to comment on one of the efforts that CMS has underway regarding Medicare Advantage, the Part C program. It's in the process of collecting encounter data from plans so that we better understand the services that they're providing to beneficiaries. I think their immediate plans are eventually to use this to improve the risk adjustment, the adjusting payments for health status, but the data has opportunities to go well beyond that and allow CMS to do a better job of oversight. And we currently have work on CMS's plans and efforts right now. We hope to be able to report later on this spring.
Thank you. Mr. Vito, would you like to comment?
I think that Medicare program is certainly a complex program, and a large amount of resources that the OIG is focused on looking at that program. We have results that continue to point out that there's things that can be done. We have shown where better use of legislation and policy rules have resulted in savings that have been achieved of $19 billion of the recommendations that the OIG has made. So we think that it's a very challenging program. We think we need to devote a lot of resources on that program in every way, whether it's evaluation, auditing, or investigating. And we could certainly use more funds to do that. But we definitely believe it's a challenging program, and we're going to do our best to keep our eye on it.
Thank you. Mr. Chairman.